International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hello everyone, my name is Helen Schneider. I come from the School of Public Health at the University of the Western Cape in South Africa. For the last decade and a half, I have been following the emergence and then rapid growth of lay and community health work in South Africa's health system, and the formalization of this sector from 2010 onwards in a strategy referred to as ward-based outreach teams. The ward-based outreach team strategy represents South Africa's version of a national community health worker program. This paper is based on a program of research evaluating the subnational implementation of the ward-based outreach teams in South Africa. Now, these developments in South Africa are not unique and are mirrored in a number of other countries in the region and in fact across the globe. And as community health worker programs shift from fragmented disease-specific, more local initiatives to coherent, comprehensive and large-scale initiatives directed centrally and linking and integrating with the formal health system, then they face a number of key systems challenges. These systems challenges arise not least from the fact that community health worker programs lie at the interface of the formal health system and communities and involve a set of complex relationships in both directions. Secondly, that successful national community health worker programs are context-specific and emerge from the specific dynamics, histories and conditions of national health systems and in fact respond to the specific local contexts in which they are implemented. So this paper speaks to one of the specific or one of the particular systems challenges faced by national community health worker programs, that is their governance. The governance of national community health worker programs has not been considered extensively in the literature on CHW programs. So what this paper does is combines the empirical observations from the implementation of the ward-based outreach team strategy in South Africa and the particular governance issues that emerge from that implementation with considerations from the field of governance, drawing on the conceptual and theoretical insights on thinking in the health sector more broadly and beyond. The paper proposes a multi-level framework for the governance of national community health worker programs that is divided into 5 key overall purposes or roles, and these roles are further divided into 17 specific tasks. So the purpose of this framework is to begin to surface what may be the everyday governance challenges of these programs and seeks to provide guidance that is useful for the stewards of those programs. It could also be a framework that is used to assess the governance of those programs, and it could be considered as a framework for the development of curricular or training programs for national community health worker programs. And I hope that if you read this paper, you will consider what lessons it offers for your context. And of course, I would welcome any feedback on the paper. Thank you very much.